Okay. Okay. Working? Okay, good. Let me put you down there. Okay. So in case we've not met before, um, my name is Evie. I'm a registered qualified nutritional therapist. This is different from nutrition or dietitian, all the different terms you can get from it. So nutritional therapy means I look at the whole picture. I look at your environment, how you're sleeping, your stress levels, your diet, everything, and your genetic factors. So I look at everything to try and pull together the best route forward for you to reach your health goals, whatever they may be. And this is just to show you that I am qualified. I've been doing it for 10 years, and um, a little bit of bragging because I'm quite proud of it. I had to work really hard for this qualification. It's taken me a long time to get where I am now. So I have been able to do some talks and get articles in some big publications. So it's been really exciting journey for me. And then if anyone knows, I've recently had a podcast with ITN as well. So I've been very, very lucky to host their podcast. And you can listen to that now. It's called Listen to Your Gut, and it's available on any of your usual podcast platforms. And it's not me talking about my experience with in clinic or anything. It's actually I've been so lucky to interview top experts all around the world, like my most favorite people that have published articles. It's really interesting. If you've got any interest in gut health, or you've got any conditions that you want to know more about how you can do treat yourself, you can listen to the podcast episode that is relevant to you. And it's a good podcast to listen to, not just me waffling on, but the experts are amazing. Okay, and I'm not going to hover on this too long, but I have got my certificates if anyone wants to ask for those. If you decide you want to work with me, it is important to ask the person you're working with for their qualifications, because there are so many people out there who aren't appropriately qualified to give you advice to make sure you're safe. So we have to, by law, I have to check your medications for interactions before I tell you any dietary recommendations or steps. It is very thorough. So what we're going to do in this presentation is going to have a quick look at the immune system, look at common food allergens, food intolerances versus food allergies, complement. If you don't know what that is, it's really interesting, but I'm not going to get too sciencey because it is quite technical. But it's a really interesting thing for you to know about if you suspect you've got food allergies or food intolerances. And we're going to look at some food antigen testing options, and is it a food intolerance? Let's find out, because in my clinical experience, it's very commonly not a food intolerance at all. So I'm going to take you through what I see in clinic that are much more likely to be the case. However, that's not the situation for everyone, and you actually might have a true allergy or sensitivity. We're going to look at that. Then we're going to look at the things you can consider, and then how to do a gut reset. I'm going to do a little recap, and then hopefully Q&A. If anyone has to dive off for any reason and you want the recording, just drop it in the chat box and make sure I know who that is who's asking for it, and I will make sure you get it. Right, so your immune system is shaped from the earliest of your start of your life, even before you're born. And so this picture really sort of depicts how your immune system is shaped, and it's modulated through your journey into the world. And so even from how you're delivered into the world. So anyone with atopic eczema or asthma, or any of what we call the atopic march, so there's sort of like dry skin conditions, autoimmunity, how were you delivered into the world? Were you a C-section baby? Were you breastfed? Did you have lots of antibiotics for a child for ear, nose, throat infections? That's quite a common pattern that I see with people who develop gut-related issues, autoimmunity, and then things like hives, or things where food antigens are triggering this response. So think about the earliest beginning and how your life was shaped early on, because quite often it holds the clue. Also, if you've had any if you've had any operations and had any glands removed, so if you've had tonsils out, or your adenoids, or appendix, gallbladder, all of these things do influence how you're going to tolerate certain foods and how they're going to get broken down in the gut. And we know that 70% of the gut immunity is the first triggering point. So it's really important for you to consider this earliest part of your life to see if that plays a part of, piece of the puzzle. So the immune system is kind of all around the body, and these glands are there to protect us, and they're there to raise the alarm and tell your immune system, okay, I want you to make an antibody to this protein or this pollen or whatever it is that's triggered it. And then the next time you're exposed to it, the idea is that your body then comes in, has the antibody ready to fight it and can fight it off. However, in the case of anaphylactic shock and things like that, that's obviously a disordered situation where you're going to trigger a true allergy. It's not as common as food intolerance and sensitivities, and then the wider picture of what we're going to look at later. But you can see your body is really primed, all of these different defense mechanisms, including your skin, your first layer, skin, airways, lungs, gut, all of this actually really matters and will have a response in response to your environment or something that's triggering it, whether it's pet dander, dust, pollen, or a food antigen. So we've got to consider the gut as that interface. It's the first place that your food that you've eaten will interact with your immune system, because inside the gut we have we're going to come on to it on the next slide. Your immune system is lying in wait in that mucus lining. But this kind of gives you a really good overview of the things that can trigger an inappropriate immune response. Stress always makes everything worse, okay? Because stress is inflammatory. It's going to raise cortisol. It's going to have a hormonal effect all around the body. It's going to lower your immune system. Obviously, vitamin D deficiency, if you've heard me talk before, you'll know I bang on about that all the time because it's so common. And if you've been tested by your GP and they haven't shown you your results, but they've said, no, everything's fine, request a copy of those results, because I can't tell you how many people I ask to do that who work with me. And then they bring me their results and they say they said everything's fine. And we look at it and in big, bold, vitamin D is deficient and other things as well, usually out of place. So please, please, please make sure you've checked your vitamin D. If you know you are that sort of immune atopic person or someone who catches lots of bugs, and we've got that winter bug season coming up. So make sure you are primed and ready to defend yourself. But looking inside the gut lining, what we know from the science and the evidence is actually what you've probably heard as leaky gut. And I don't really like that term because it's not very effective at explaining what's really happening, but it's a nice, simple way of telling you what's happening in that gut lining border. Is the mucus layer that sits on top of your gut lining is degraded for various reasons. It's different for everyone, but that can be because you've had a gut infection. It could be because you've had poor diet in the past. It could be because you've taken a course of antibiotics. You could just be prone to having the bugs in your gut that actually like to eat and feed off that mucus layer. Now, that mucus layer is really important because that's where all the good bacteria hang out, and they protect you from actually the food that you eat being broken down and touching the cells. And inside the cells, we have our immune cells, which we're going to look at next. And they literally reach out through the gut lining. It's incredible if you see it under a microscope. They reach out through the gut lining and they kind of handle these food particles, and they decide whether they're going to create an immune reaction to it or not. If there is some inflammatory response, the first thing that will happen is your immune system will be triggered and this inflammatory process happens. And usually what happens is the mast cells in the gut lining, they degranulate and they release histamine, which can make you feel uncomfortable, itchy. You might get hives, flushing. You might get upset tummy. So histamine is the thing that usually triggers a lot of the symptoms. But it's not always a food intolerance or a food allergy that does that. It can be because of this broken mucus layer in the gut lining and this what we call leaky gut. So hopefully that's explained it well enough. And that obviously leads on to autoimmune disease. Now, I have an autoimmune disease. I have Hashimoto's, and I can tell you that that picture really depicts what happened to me over 10 years ago, I had a very, very stressful incident in my life, turned my life upside down. And at the time, I wasn't looking after myself, because when you're under a lot of pressure and stress, you tend not to think, oh, yeah, chickpea, raw food salads, and, eat, looking after yourself. I was not looking after myself. I also had anemia and vitamin D deficiency. And that was enough. All of those pieces of the puzzle were enough with my genetic predisposition to trigger an autoimmune reaction. So I did all the good work that I'm going to take you through what you can do to make sure that your gut lining is really, really strong, and that resilience is there inside the gut to protect you, because that's the best thing you can do as a first line defense against any inflammation and intolerances and allergies. So here's a lovely picture of a healthy gut. This kind of explains a much closer picture of what's happening. So the gut cells, nice and tightly closed up together. Between them, it's called tight junctions. The tight junctions are tight. You can't slip anything between those tight junctions. So the gut cells are lining, facing you. They are protecting you with the little villi there at the top. And underneath, you can see your immune cells, the T cells, B cells, macrophages, dendritic cells. The dendritic cells are the ones that do this arm up and they sample and touch the food. Incredible. And then you've got the mucus layer. You can see how lovely and thick that is. Lovely, thick mucus layer. All the bacteria happily sitting on the top of there. They're all communicating, and they are creating something called short-chain fatty acids. Now, the short-chain fatty acids, I can tell you from all of the stool test results I do with my clients, that the people that feel the best and that are in the best health have the best production of short-chain fatty acids. They are critical. They create things like butyrate, probably the most well-known one. If you want to know more about this, I've got a blog on it and I can send you more information. So make a note if you want to know more about that. But I'm going to, for the reasons of time, I'm not going to spend too long on it. But that gives you a lovely overview of just how important that mucus layer and the bacteria there that are able to produce these short-chain fatty acids, they are protecting you. They're anti-inflammatory, they control hormones, they make you have more better metabolism, they protect your immune system. They're really, really important. Then you look at the inflamed gut and you can see what's happened. It's broken. That mucus layer is completely degraded. So the bacteria are now sitting on the cells in the gut. So the food intolerance, the food sensitivities, the food allergies, they are triggered and made much, much worse in this situation, because your cells don't really know whether they're coming or going. Are the bacteria friends? Are they foe? They haven't got the mucus layer protecting them. And usually the bacteria in this sort of inflamed gut are not the best species of bacteria you want them to be hanging out in. They're usually candida, yeast, viruses, actually, and parasites sometimes, way more common than you think. So that gives you a much better picture of this inflammatory process that starts inside the gut. So it's gut-associated lymphoid tissue, which is why we just call it GALT. Okay, so the GALT is what we were talking about, those immune cells that sit inside there, and they are your surveillance team. They are protecting you, and they are deciding what is allowed in and what's safe and what's not safe. Okay, and you can see on the last paragraph, constantly monitoring the gut environment, and it's watching for pathogens, but it gets confused in an inflamed gut situation. When that gut barrier is broken and the mucus layer is degraded, it's letting dietary antigens in and commensal bacteria. Your bloodstream does not like that. It's like, what is that? That's not Evie, that's not Sarah, that's not Vicky, that's not Kerry. Who is this in my bloodstream? It thinks it's a protein that's going to do something bad to your body. So it raises the alarm and it creates this immune cascade and inflammation. So even though the things getting through are commensal, which is like not good, not bad bacteria, they shouldn't be in the bloodstream and they can trigger an inflammatory response. Now, these are the top 9 food allergens. So if you actually have a true allergy, these are probably the biggest triggers, as well as things like environmental triggers like pollen, things like that, and pet dander, and dust. these are the food allergens. They're very, very common. And usually if you have a food allergy to one, you usually have more than one food allergy. We're going to look at the test that is really going to give you the answers if that's what you really want. But I'm also going to take you through what I see much more common, because before you spend the money on this test, a test like this, you need to consider these other factors. Because if you were going to come and work with me, I would never want you to spend that much money without me looking at your gut resilience, your gut lining integrity, your diet, your lifestyle, your stressors, and talking about all of that background picture. How were you delivered into the world? When was your last course of antibiotics? Have you had a very stressful event in the last 10 years? Have you had a gut infection? Have you been away to Egypt and got a nasty tummy bug? All of these things start to disrupt that picture that we looked at inside the gut. And so it's not always a food allergy or food sensitivity. It's sometimes just down to a broken, disordered gut. So these are the common allergens, though. If you know you actually do have an allergy to these, then you're going to find the next few slides quite interesting. So IgE is the true allergy. So this is the antibody that's made in response to an allergen that your body has created this IgE reaction. These are the common allergy reactions, and they can turn into anaphylactic shock in some cases. So it's quite an instant response. It's within minutes to hours of being exposed to that allergen. So the risk factors of that is usually a parent will have allergies, or you might have chronic asthma or eczema, makes you a higher risk to allergies. Now, IgG is not allergy. This is just a food intolerance or sensitivity. These responses are the ones that cause the most confusion for people, because you might eat something, one day and think, oh, you feel okay actually. And then 3 days later, you get symptoms and you think, what have I done today? Why have I got bad stomach today? I don't feel good, or, just don't feel right in myself. But it could have been something you ate days ago. This is the problem with the IgG. It's a delayed response. But it can be measured by a blood test. However, what I would caveat that with is if you don't have a true allergy, and this isn't a critical thing for you to know, it's much more important that we work through the other things I'm going to take you through in a moment, because IgG responses are created in someone who's got a bit of a broken immune system because of the gut lining or all the stuff we just looked at. And it causes a lot of confusion, because if you went and did a food intolerance test, and some of you might have done it, and get this big long list of all the foods that you can't eat because you've raised an IgG response to it, it becomes very, very restrictive. And actually what we know is that's the worst thing to do for your gut. To restrict your diet even more is actually asking for, trouble. It's going to cause more problems further down the line. And the IgG responses are just because of that broken gut border we looked at. So it could be mucus degradation, the wrong bacteria in there that are playing havoc. It could be because you had a recent course of antibiotics. That's not a good time to do a food sensitivity test, is on the back of not feeling great, because I can tell you your list of foods to avoid will be vast. And the people that I work with that are in the worst shape and in the worst health, I've been on very, very restrictive diets, basically using something like a food intolerance test. So although you'll come onto this webinar to learn about food intolerances, I'm not bashing those tests and saying they're really bad. In some cases, they're amazing. I've had amazing results with people with chronic eczema and asthma, long-term chronic conditions, because we've been able to look at exactly where we need to pull out those triggers to get control of the inflammation. But actually, we put them all back in. So it's not really a true food response that you need to pay too much attention to, but you do need to work with someone who's experienced and can guide you, because if you end up on a restrictive diet, it can make you a lot worse. So I'm not going to go into the science of this, but what I wanted to show you in this slide is they are 4 subsets. Now, IgG responses, this is what we're talking about, food intolerances or sensitivities. 4 different antibodies are made, and Ig1, 2, and 3 will trigger a response. they will cause a food sensitivity issue. It's slightly experienced slightly differently in each of you because you're unique. You have a different unique set of genes, environment, likes, dislikes, food choices. So it's slightly different for everyone, but it will trigger a response there. Let's call them inflammatory triggers. But the IgG4 is incredible. Actually, what we've learned is that IgG4 actually prevents you from having an allergic response. So if you're prone to these allergies and intolerances, the IgG4 is actually protective. It actually mops up and blocks the allergen from triggering an IgE response. So what we're looking at here in this first picture, you can see all the, let's say the purple cell on the left is releasing histamine. This is what I was talking about. It's a mast cell and it's degranulating. That causes the inflammation. This is the degranulation process that makes you feel rubbish, cause hives, slightly feeling itchy. It might cause tummy ache, might cause a headache, slightly different for everyone. But this degranulation is the thing that's happening in that response, IgG response. On the right, you can see that the IgG4 has picked up the allergen and taken it away. It's prevented the mast cell degranulating. Therefore, it's stopped the allergy response. So it blocks it. And actually, we think it's a very anti-inflammatory. So it's brilliant to have this IgG4 response. And this is why you might have heard of someone who said, I used to have an allergy to milk, but actually you grew out of it. This is why, because your IgG4 has picked up the allergen, stopped it from being triggered. So that's another explanation for what happens, and you can feel it all around the body. But what we're looking at now is complement. If you've not heard about it, it is the immune cascade. It's this ramped up inflammatory response. It will create degranulation, but in response to that IgG response, let's say it's a response to fish, and you're creating an IgG response to seafood or fish. If you're creating a complement response, that IgG response can be ramped up 10,000-fold. So you can get a really huge response off it. Now, if you've got a few responses going on at the time, this is why it can get confusing, is because you might have eaten something that triggered a bit of an IgG response, and then the next day you eat something you think you're okay with, and this complement kicks in and it ramps up the response 10,000-fold. So the test that I'm going to show you is this P88 antigen test. I'm not going to spend too much time on it because it's very, very expensive. And in my clinic, I've used it a lot of times to brilliant effect, but it's been in a specific case. So something like I said was someone trying to come in. Someone like with chronic asthma or eczema, something that's gone on for a long, long time and they can't get to the bottom of it. It's incredible, this test, because it will tell you your IgG, IgE, IgG4 and your complement response. So you can see exactly what foods you need to avoid to prevent that ramped up response, get the inflammation under control, then you can heal the gut, and then you can get back to living a normal life, enjoying food without all those reactions. It's expensive. I wouldn't use it as a first port of call, but it's there for you. It's there for us to know, okay, we need answers now. We've done the dietary stuff, we've done the gut healing, but you're still getting these reactions. Then I'm going to say, this is where you need to spend the money because it's worth finding out exactly what's triggering those responses. But I wouldn't use it as a first port of call. I'm going to look at you what else can be very common reasons for these symptoms. Now, whether you feel it is headaches, fatigue, or whether you actually do feel it in the gut, in the tummy, I would love to know. At the end, we're going to look at that and see if I can help you. But bloating is a really common one. If anyone gets bloated after eating, quite commonly I hear people say, well, I wake up with a flat tummy and by the end of the day I look 6 months pregnant. If that's you, this is the slides coming up for you that you need to pay attention to, because this is much, much more common. Oh, someone's got, let's me mute them, right. So symptoms of maldigestion, because that's what I would say is much more common. Does anyone recognise all of those symptoms, any of those symptoms, or a collection of those symptoms? So the burping, acid reflux, that can be very, very common if you've got bile reflux, if you've had a gallbladder removed. Menopause is just such a pain, isn't it? It just creates so many problems for us, and it's so unfair, but it can really muck about with how you digest your food and your gut motility. So you might get bloating, flatulence, you might get loose stools, you might get a feeling of like distension. Quite commonly, I work with people and they say the food just feels like it's just sitting there like a stone, it's just not, it's in the stomach, it's just not going anywhere. Another common one is feeling really tired after eating, like more like almost like you need to go and lie down. That's really common. Or you might have been told you have IBS, or feeling full very quickly, so you're not really able to finish your meal, feeling nauseous. All of these things are not necessarily a food intolerance. They can be a problem with your whole digestive process. These are much more common. This is what I work with every day, digestive enzyme insufficiency. So whether that's because you might be taking a PPI, so you might be on omeprazole, lansoprazole, that affects how you digest your food because you can't then produce the appropriate amount of stomach acid and stomach juices to break your food down. But I can work with you to help you manage that. I would never tell you to come off your PPI, but actually I can now help you de-prescribe that with your GP's permission. So if that sounds like something you need to work on, we can definitely do that. Poor eating habits. How many of us are eating in a slouched position, rushing our food, eating on the hoof, just on the go, grabbing something, getting in the car, or finish food and then bend down, emptying the dishwasher, things like that. Low digestive function. So this whole capacity to digest your food can just be disordered. And that's for various reasons. Like I said, might be PPIs, or when you go through menopause, we tend towards the hyperchlorhydria state, which means your stomach acid reduces. So you can, even though you're getting acid reflux or indigestion, you've heard this before, I'm sure, it can be because you're not producing enough acid. And then the food is just sitting there like a stone in your stomach, fermenting, bubbling up, pushing up against that lower esophageal sphincter, causing that acid reflux. It can be much more common than a food sensitivity or intolerance. Your dietary choices, there might be a food in there that you're not able to break down anymore. Something you used to eat and used to have no problems with, but now you find, I used to eat it and I was fine, but now I'm getting bloating, uncomfortable, maybe even some urgency, or like I eat and then I need to rush the loo. Might be the other way. Might be really constipated and the gut motility is really slowed down. So post-menopause, post-gut infection, post-antibiotics, all of these things can affect how we digest our food. And stress makes everything worse. So if you know you're really stressed at the moment, you're not giving enough time to your meals because you don't have time, or you're skipping meals, they can be signs that your disordered eating pattern is starting to have an effect on how your gut's actually functioning. Another common one, gut infection, overgrowth, which we might call SIBO, small intestinal bacterial overgrowth, or parasites, much more common than you think. I had a case last week. This poor lady, she'd come to me, she'd had these issues, I'm not joking, for about 15 years. And she said, I don't think you can help me. I've been through everything. And we got through the consultation. I asked her lots and lots of questions. And I said, I think you've got worms. And she was like, worms? Anyway, she went to a doctor and she phoned me a week later. She said, I cannot believe it. She said, I had to get rid of the worms. I took the thing that the doctor gave me and all my symptoms have gone. So actually, it's working with someone who's got the experience to sort of be able to notice these patterns or common triggers. Worms are way more common than you think as well. It's not very nice to talk about or think about, I know, but if you've had it for years, we need to go down this sort of break down what's really happening, talking about what stools look like, your bowel habits. They tell me so much and can give me real clues. Like if the stools are floating, we used to think that we've been told that, that meant you had a really good diet that was high in fiber, but actually it's not that at all. It means that you've got fat in your stool and you're not absorbing your fats. And then that would tie in with someone who had that dry skin, that atopic heat eczema sort of feel, or, you know, dry hair, dry skin, that dry condition, slow energy, slow constipation. All of those things can actually be down to not absorbing your fats properly. So we can look at all of that. So that goes back to digestive enzyme insufficiency, way more common than food allergies and real intolerances. So how are you going to work it out? So to support your digestion, think about where digestion starts. Have a think about that and drop in the chat. Where you think digestion starts. And we're going to, at the end, we're going to do Q&A. So I'm really intrigued to know where you think digestion starts. Think about that. And your nervous system, you know, we quite often go into meals because we're short of time, haven't got time for this, don't know what to eat, open the fridge, I'll have that, grab that, eat that, off you go to your next job, something much more important that you've got to do than actually digest and eat your food. So when we're in that state, our body doesn't really understand what's going on, and you're about to put food down into the stomach, and the stomach's not primed, not ready. You haven't done the anticipation, you haven't thought about it. Okay, and then you haven't chewed your food properly, and then you've got these big chunks of food sitting in the stomach, and they ferment and bubble up, and they can cause this feeling of distension, can cause a lot of gas. And then we don't rest and digest, you know, we're off to do the next thing. We're all time poor, and we don't give enough food to this digestive process. So our digestive system is really perfectly designed, but we are brilliant at getting it in its way. And we've got any excuse, don't have time, time poor, can't eat, don't chew my food, then I've got to go off and, you know, pick someone up or do the next job or do a load of emails. You know, there's always something more important, but your gut, poor gut, really needs a little bit of help. So think about that and drop in the chat. I love that. So I've got some nice, when you're considering what to eat, yes. In the mouth, the brain, before you even start eating. Charlotte's on the right track there. When you smell the food, Jackie, yeah, really good one. Your senses, you know, your eyes, the smell, the look of the food, the preparing, the touching of the food, the imagining what the food is going to taste like, that process alone can create 30% more digestive juices than just shoveling it straight in. So you're putting in your food into, think about your stomach as a tank of, you know, acid. It's about to break the food down. Have you prepared it? Have you given it enough thought? Have you given it the anticipation it needs to get the juices going? That can alone can be such an amazing step to really practice. That's something you can go away and try and see, does that make me feel better? Do I feel better when I really take my time and chew my food properly? Another one for you to put in the chat box. How many times are you supposed to chew your food before you swallow? Put that in the chat box for me for when we do Q&A. If any of this has resonated with you and you think, okay, I probably need a bit of help untangling this and I don't know where to start, I always offer a free discovery call service. So you can just book a call with me. You can email me. And if you want to book an appointment, we can just have a 15-minute chat. We can Zoom if you prefer, or I can just pick up the telephone. It's free. And I will guide you on that phone call to what I think your next best moves are, your next best steps. If I think I can't help you, I'm going to signpost you. I'm not going to just try and get you to work with me if I don't think I can help you. So book that free call, because it's the first step to you really getting the answers you need for progress, for you to feel better. The gut reset offer is a 1-hour Zoom. Now, this is a one-time offer. This isn't just me dangling a carrot and saying, oh, you know, next week you're going to see this offer. I mean, this offer ends today because I can't really afford to do that long term. But if you want to have the 1-hour gut reset with me, you can have it for £150. That's £50 off. But you need to make the booking today. So you just need to email me. If you want to do that, we're going to walk through your digestion. I'm going to help you optimize your digestion. We're going to look at your enzymes. We're going to look at, is there an overgrowth? What's your gut resilience like? What's the mucus border sound like it's doing? What's your bowel habits like? Then we're going to look at the right diet for you to really focus on getting those, what you think might be a food intolerance, under control, get you feeling more comfortable. I will help you connect the dots so that you understand why you're getting those symptoms. From over 10 years experience, I would really like to think I can help you get some progress. And we will look at testing. If we feel that's the next best move, I'm going to tell you and tell you the cost involved, but for £150, I have excellent outcomes using just dietary lifestyle modification and explaining to you the common triggers and the symptoms and why you're getting them. Once you know that, you're in the clear and you know what you're doing. Visit my website for free recipes. There are lots of blogs and information on there. If you don't want to book that free discovery call, go and have a look on my website. But I would encourage you to book the free discovery call because it allows me to find out more about you and your unique situation, because everyone's different. And then if we feel that P88 antigen test is the right one, I'm going to tell you if I think that's where we're going, so you can be prepared and know what's coming up. If you're not following me already, please give me a follow. It's a really lovely way for me to keep in touch with you, and you can ask me questions on Instagram, Facebook, LinkedIn. So do follow me and book your free discovery call. And subscribe if you're not already subscribed. If you subscribe to my newsletter, I'm getting much better at my newsletters, and there's lots of free, amazing ebooks and recipes coming out your way. So stay subscribed, and hopefully you will be enjoying those recipes and things soon. And now we're going to do Q&A, and if anyone's interested in the next talk I'm doing, it's a free talk like today. It's sick and tired of being tired, because the number one common symptom I get from everyone is I just feel so tired. And so if you want to triage that tiredness, let's work through the common reasons why you're feeling tired. Then hopefully you'll go away and be able to implement some strategies to get a bit more energy in your daily life. If you're interested in that, drop me an email, info@evienutrition.co.uk. I'll make sure you get the next steps to book onto that free webinar. And that is us. So I'm going to hang on a minute. I'm going to stop recording. How do I do that? There. Stop recording.